Good afternoon or good morning, depending on when you're listening to this. This is David Ross with the Mental Health and Recovery Board of Ashland County, and this is what we sometimes call Dreams for the Least of Us, which is a mashup of a couple titles of books, best-selling books by Sam Quinones that we particularly like here in Ashland County. He's talked quite a bit about the substance use issues that the country's facing, and Ashland County is not exempt from that. And on this particular podcast, what we like to focus on is a little bit about the substance use issues that we're seeing, talking about how we're responding, and occasionally we go beyond even Ashland County to talk about some of those broader forces as it relates to substance use, some of those issues, factors, and otherwise that might be driving or mitigating against substance use in the county. So some quick updates that folks may or may not be aware of locally. One I wanted to spotlight is Celebrate Recovery, which is a faith-based AA program, again, for folks that are struggling, not just for substance use, but any type of behavior that is seen as repetitive, addictive, if you will, and harmful. And this is a group that had been active for some time with one of our churches locally, but then we had a pause, but it has restarted. And for many individuals with more of a faith focus, not that AA doesn't have a faith component, but some folks want it to be more intentional. So Celebrate Recovery is sometimes a better fit for those individuals. And we are happy to report to you that one of our local churches has agreed to pick that up, and that's New Life Church, and that's at 1489 State Route 511 in Ashland. 1489 State Route 511. So we appreciate the folks there at New Life Community Church picking up that program. It meets on Thursdays. It starts with a meal at 5:30, and then goes into the programming at 6:30 and then at 7:30 with some small group breakouts. So I encourage folks, you can go to the ashlandnewlife.org website, ashlandnewlife.org website, and /celebrate recovery for additional information about that program. But again, it's more of a faith-based program for folks that are struggling with substance use as well as other hurts and hang-ups sometimes is the expression you might hear. So we wanted to commend that to you as another option, whether it's for yourself or a loved one that you might be trying to support and help through this difficult time that they might be experiencing. In that vein of assisting and helping, we've had on the podcast in the past some of our prevention educators that work primarily through ACADA, one of the board's contract partners. They have the board funds prevention educators in K through 12 in our school systems here in Ashland County, and they, as well as many, many other prevention educators, will be at Ohio's Prevention Conference August 19th and 20th. That is coming up down in Columbus. So if folks are interested in learning more, if you're in the prevention field or just are curious about what folks do in the prevention space, check out the August 19th and 20th Prevention Conference down in Columbus. It's going to be at the Hyatt Regency, and folks can register for that at the preventionactionalliance.org web page, and that's all one word, preventionactionalliance.org. Check out the Ohio Prevention Conference. Lots of good information. Next, I wanted to spend a little bit of time on an update to a resource that we actually trained in with our Chamber of Commerce some years ago. It was the Opioid Toolkit that they produced, and this is through the Ohio Chamber of Commerce. They produced an opioid toolkit to help Ohio's employers. You know, Ohio's employers were really struggling some years ago when the heroin was the primary drug at that time. It's moved on, obviously, to fentanyl and meth and some other things. But employers were asking the Ohio Chamber and their local chambers for help in how do we approach this issue in the workplace? How can we hold on or help or support workers, especially when these are highly trained, specialized workers that not easy to replace? So the toolkit was a result of that. And this is free, no cost. It's offered to anyone, really, but it's specifically designed to assist employers, and it's ohiochamber.com/opioid toolkit. ohiochamber.com/opioid toolkit. And the reason I'm bringing it up now is they've made some adjustments, some updates. As I said, when we first trained on this module and brought it to the attention of our local community, heroin was really the drug of choice. Obviously, some things have changed with regards to the opioid epidemic with fentanyl. Also, there's been some changes in Ohio with regards to marijuana, recreational or medicinal. So they've tried to update that resource. But I would, if you're an employer, particularly if you're in HR, and you want to educate yourself more about how prevention or substance use treatment or constructing a drug-free workplace policy and procedure, how all those things are, you can find that information at the ohiochamber.com/opioid-toolkit website. So check that out. I think you'll find that of use. They put a lot of money and time and energy and effort. Most of it's video-based, so it's not a lot of reading. And I think that's helpful for a lot of folks that are on the go and busy. Another issue had to do with an article that was in our local Times-Gazette not too many weeks ago, talking about overdose deaths in Ohio reached an 8-year low. In the article, talks a little bit about what the reasons might be, and there are several reasons, but to be honest with you, I don't think we know for sure. I think the author of the article even referenced that. I think the good news is since January of 2024, we have seen some drop-off in overdose period, but also overdose deaths, which is good news. We in Ashland County experienced some of our highest numbers in 2023 in terms of overdose deaths, and we've been trying to redouble our efforts to make sure everybody understands that there are mechanisms in place like Narcan, drug reversal medications like Narcan, as well as drug drop box, one in Loudonville, one over at the Ashland Sheriff's Lobby. There on Main Street to get rid of unnecessary medications, but also, to get into treatment. And a lot of these things collectively, we believe, from the Narcan through getting the unused excess medications off counters, through the treatment, through the prevention, through the awareness, the dangers of fentanyl. We think we have also noticed the same trending in lower overdose, as well as overdose deaths here in Ashland County. We're hopeful that trend will continue throughout the rest of 2024, but we are encouraged by the first 6 months of preliminary data at this time, and it was nice to see that perhaps what we're experiencing in Ashland County is also a trend more broadly in Ohio. Just a few other things I want to make folks aware of. On the national scene, one of the things that we're noticing is a challenge south of the border when it comes to chemicals that are called dual-use chemicals. And what I mean by that is these are chemicals coming into Mexican ports primarily from other countries where the chemicals technically could be used to make different products as well as methamphetamine. So maybe perfumes, for example. And it's somewhat challenging for law enforcement to crack down on some of these dual-use chemicals because if the entity is claiming it's for one purpose, but ultimately it ends up being for an illegal or illicit purpose, they may not always know that. So I draw attention to just that phenomena of, I hear this a lot, how is it that there are so many of these drugs being produced, and this is one part of that, is that the dual-use chemicals sometimes are hard to crack down on and limit because sometimes there's a plausible explanation as to why they're coming in. It's for this purpose, but unbeknownst perhaps to the law enforcement folks, they end up using the chemicals for illicit purposes, primarily the manufacture of meth and or or fentanyl. Last but not least, I wanted to touch on an issue that, we dealt with, 10, 12 years ago in Ashland County, but it has reemerged, and you or a loved one may have bumped into this. And if you haven't, I want you to be aware of it. And that has to do with receiving treatment on an outpatient basis for opioids. And medication-assisted treatment is the evidence-based approach for helping individuals that are struggling with opioid use. And it is found to be very, very successful. Well over 70% of folks that stick to the program find benefit from it. But let me unpack those terms a little bit for you. There's a medication that comes alongside treatment. That's what makes it effective. So the individual is not in active withdrawal at the time they're receiving treatment. Because as we know, somebody who's in active withdrawal does not make a good treatment environment. The person is not able to focus, do the work, be in group, even individual sessions if they're in active withdrawal. So the idea of the medication to stabilize the person so they're not in withdrawal, but they're not high, but they're also not in withdrawal, but they're able to receive and benefit by treatment. But the treatment piece is just as critical as the medication piece. And that's why I wanted to bring this up. There was some articles recently where doctors, primary care physicians, I think, were most in view in this article, but some primary care doctors or others are hesitant to get involved with medication-assisted treatment, prescribe the medications, because they feel like the treatment part is not coming alongside their part. But that's important. I can understand a physician's reticence to get involved with medication-assisted treatment if the treatment part, the groups, the individual sessions aren't also going along with the medication. So the doctors don't want to be in a situation where they're just prescribing the medications and that's it. And I would say to you, if you yourself or a loved one, if that's all you're receiving is just the medications without the treatment that goes with it, you're not really in a medication-assisted treatment program, because that program is an evidence-based program, but only evidence-based when both those things are present. So both the medication and the treatment, typically outpatient treatment, is happening at the same time. And those two entities, if they're different entities, say you have a 3rd Street here in Ashland County and Acada, they're talking all the time. They're sharing notes. Of course, you've signed off if you're the person receiving care in terms of confidentiality and a release of information. But that's the program. Both your physician, your doctor, your prescriber, as well as your treatment team, they should be collaborating on how you're doing, what progress you're making, what are those challenge areas, et cetera. So I just want to reinforce for folks, if the medication is not accompanied by the treatment side of it, you're not really receiving medication-assisted treatment. And I would tell you that, I'm not so sure that program is going to be helpful or beneficial to you, because, again, medications in and of themselves aren't going to help an individual problem solve, develop skills to deal with depression, anxiety, conflict management, relationships, play this out, right? So individuals begin to use and continue to use substances for a lot of reasons. They tend to be complicated, complex, developed over time. So just taking a pill or a series of pills in and of themselves won't help with all those other issues. It might put the person, though, in a situation where they can more readily accept and benefit by those services, but in and of themselves, it is not sufficient treatment. So that's my little take on that article. But it is important that if physicians do want to get involved with medication-assisted treatment, they have every right to expect that they're going to be partnering with an organization that will be actively involved on the treatment end and will be sharing progress notes, updates, and they will be fully collaborating not only with the individual, but the other side. So the doctor with the outpatient treatment team, the outpatient treatment team with the individual and the doctor. And I hope some of this has been helpful to you. As I say, this is David Ross with the Mental Health and Recovery Board of Ashland County, Ohio. The board does have a 24/7 crisis number we sponsor through Appleseed Community Mental Health Center. We encourage folks to call that number. talk to the local person who answers. They can answer a lot of your questions. They can also help to route you if you're in crisis and need additional help. And that number is 419 289 6111, 419 289 6111. And of course, the Mental Health and Recovery Board is also available to answer questions you may have about any of our providers, but just services in general in Ashland County. I don't want to assume that everybody knows where to go when they're struggling, they or a loved one. So you can always call us Monday through Friday. 8 to 4, 419 281 3139. The Mental Health and Recovery Board again, 419 281 3139. And this has been David Ross with the Mental Health and Recovery Board of Ashland County, Ohio. Thank you for listening.